Lagos may be the epicenter of the coronavirus pandemic in Nigeria, but the index case was actually first discovered in Shagamu, Ogun State. And according to the latest data from the Nigerian Center for Disease Control, NCDC, Ogun State has 7 confirmed cases of COVID-19. Now, let's bring in the state's health commissioner, Dr. TOMI, who joins me now from our off-site studio. Good to have you at this time, especially at a time when we know that, yes, indeed, you are truly very busy. Thanks for joining us on the show. Now, let's begin with that lockdown and the fact that the index case in Nigeria on February 27 was actually discovered in Ogun State. To date, Ogun State has 7 confirmed cases of coronavirus. When the president declared, the lockdown, the 14-day lockdown, Ogun State did ask for a 7-day moratorium. How much impact, has this 7-day window created for you, especially in preparing the health sector for COVID-19 outbreak?
Good morning. Thank you very much. The 7-day period was used to prepare the people of Ogun State to ensure they had adequate food and the necessities, and also for the market traders to actually be able to get rid of their wares and so that they don't perish. With the healthcare workers, we were able to mobilize our healthcare workers, finish off our isolation center, equip them, and also train our workers so that they could easily respond if we had a scaling up of the outbreak. So those 7 days was used in that constructive way.
And now, of course, you do have a lockdown in Ogun State. And just like in Lagos and the FCT, many people are complaining about the impact of this lockdown. What's the impact in Ogun State, and how are you planning to ameliorate some of those, negative fallouts from the lockdown?
We're 9 days into our lockdown, and if you look at the news, Ogun State people have been rather compliant. However, to relieve the effect of the lockdown, what we've been able to do is to give them a respite every 48 hours, where between 7 to 2 p.m. they're able to go out to get more food, get medication, and also to fend for themselves. As you know, most Nigerians do earn their living on day-to-day basis, and to fight this COVID virus or the infection, they have to ensure that their immunity is up to scratch. And if they don't feed well, then it could affect their immunity. So we were able to give them 48 hours, every 48 hours, a period of time to go out, get some nourishment, earn some living. So if you think about it, a well-being of the people is not just the lack of, disease, which is health. You have to think about the well-being of the people of the state. So we're looking at the psychological, financial, and emotional well-being, as well as the absence of disease.
Still on the issue of the lockdown, it was quite disheartening to hear this morning, that robbery cases have been going on in places like Ayepe, Ifo, and Agbado area of Ogun State. Talk to us about that and what's been done to ensure that people have that sense of safety, that robbers will not take advantage of this lockdown. We
have a task force with the forces that go around to ensure the safety of the people of Ogun State. As well, as I mentioned previously, that we do let people out every 48 hours to actually fend for themselves. You'll be aware that the majority of the population are youth, and they earn their living day to day. So I think the reason for the increase in robbery is lack of earning. So by letting people go out to fend for themselves, that hopefully would address that issue.
Let's really hope so. Now, talk to me about this self-assessment tool, an app that you have. Exactly what is it about, and how is it helping in tracking COVID-19 cases in Ogun State?
If you look at around the world, the countries that have actually had effective lockdowns are the ones that have used their lockdown to increase the screening of their population and to strengthen their healthcare, and also to have social distancing. Those were the 3 key success factors. So in Ogun State, what we've done is we've actually provided, deployed a mobile app, which you can download from www.covid19.ogunhip.com or *723 *19 *2#, which you can self-assess yourself. You can self-assess at home in the comfort of your living room or wherever you are on your mobile phone to see if you're low risk, medium risk, or high risk at developing COVID-19 disease. And we in the Ministry of Health, we have a dashboard where we see the people that are red, they flag up, and the state epidemiologist then follows them up and place a phone call, and if need be, we go out to perform the swab test. Also in the state, we have actually taken possession of a molecular lab to increase our testing. In South Korea, that was what they were able to do. In increasing the sampling of the population during the lockdown, they were able to quickly flatten the curve, and now they are on the downward trend, as published in the news about 48 hours ago.
Yeah, and the 48 hours, would that not run contrary to the objectives of that lockdown, where you can expect that people will rush out to buy, and it flies in the face of the physical distancing or social distancing that, you know, it's supposed to be a part of a solution or a preventive measure for contracting COVID?
What our Governor, Prince Dapo Abiodun, has said, directive he's given to the people of Ogun State is when you're out, you have to wear a mask. That ensures that if someone does carry the virus, they're not able to transmit it to others. And also, it serves to protect you from touching your face, your mouth, and your eyes if you have contaminated hands from touching contaminated surfaces. And during the 48-hour lax period, people are still meant to maintain the 2-meter social distancing and encouraged to stay home if they have no business going out. The release of the laxing of the lockdown is actually to allow people to do essential things. If you have no essential duties to perform, you don't need to go out. So I don't think it's counterproductive. As you've mentioned earlier, there's been robbery and theft. I think it's important to keep the youth engaged and to ensure they're still earning money even during the lockdown.
And as Health Commissioner, we do hear that it's your ambition to make Ogun State, a health tourism hub. But that's quite ambitious. But let's even bring it to the COVID-19 issue. You do have 7 cases in Ogun State, not too terrible that you want to worry very seriously. But let's talk about the healthcare professionals who are the front line of the COVID-19 war. What are you doing to ensure that these people are well protected, that their lives are not put on the line?
Ogun State, for our frontline healthcare workers, what we've been able to do is we've provided insurance, life insurance for them, and we've given them hazard allowance. We've given them personal protective equipment, and they are regularly, I check in on them regularly just to make sure that psychologically they are, their well-being is being looked after. That's what we've done so far in Ogun State.
Okay, now, we know that the federal government has earmarked some huge amount, about 1.1 trillion, including other, interventions from the CBN and the organized private sector. Is Ogun State accessing any of this palliatives so far?
We haven't been able to access them, but going forward, I just came off a conference call with the National Task Force on COVID, so I'm sure we'll be able to access some of those palliatives.
And quite a number of corporate organizations and religious bodies have been, pooling resources together to help the state government in helping provide for the most needy in society and the most vulnerable. Are they getting these supplies at all? What is the level of success so far?
The Executive Governor of Ogun State, Prince Dr. Abiodun, has actually made provision for 500,000 palliatives to be distributed to homes. And in the first instance, we are rolling out, we started last Saturday, 100,000, and we'll continue to roll out the palliatives at different local governments, wards, CDCs, and CDAs to ensure that it really gets to the grassroots people that do need it. It's to the vulnerable, the elderly, and the poor.
And I do recall that Governor Dr. Abiodun did declare a state of emergency in the health sector in Ogun State. And that was long before COVID-19. How much difference really has that declaration made for the health sector in Ogun State?
On arrival to government, Prince Dr. Abiodun did a tour of the health facilities and saw the state of the health facilities, and he made a commitment to start developing them. The University Teaching Hospital, Olabisi Onabanjo, the University Teaching Hospital, was one of the first beneficiaries of the refurbishment. Then the General Hospital in Ilaro was totally refurbished as well. There's an ongoing work on refurbishing and equipping all the facilities, which is part of my strategic goal. We currently in Ogun State, given with the COVID-19 disease scourge, what we've been able to do is set up 4 isolation centers. One of those isolation centers is actually in the General Hospital Iberekodo in Abeokuta, which means that this General Hospital is being upgraded and refurbished and equipped. So long after COVID, it could be put to use by the people of Ogun State. Also, the Olabisi Onabanjo University Hospital is one of our isolation centers, where we have ventilators. We've purpose-built an isolation center, which beyond COVID could be used for Lassa fever. We've made that our medium risk isolation center. Thirdly, we have a 10-bed isolation unit, ICU, intensive care unit, that we are using as an isolation unit for the severe cases. It has a purpose-built ICU, piped in, and central gas. It's probably the best ICU in West Africa. So we're engaging all these facilities, and they will last beyond COVID because there must be life after COVID. And as you mentioned, we're strengthening the existing healthcare system so that the people of Ogun State could continue to enjoy the improvements we've made beyond COVID.
Now, some governors, we'll have to leave it there. I was going to ask if you would support, continuation of the lockdown in Ogun State, since you have just 7 cases. Well, we'll have to leave it there. Dr. TOMI Koka is the Ogun State Health Commissioner. Thank you so much for joining us this morning.